Hello, I'm Dr. Charmaine Scheibar, Medical Director for the School Health Program for the Healthcare District of Palm Beach County and Pediatrics Director for C.L. Bromback Primary Care Clinics. Our school nurses staff more than 200 registered nurses in nearly 170 public schools and serve more than 180,000 students from pre-kindergarten to 12th grade. The Healthcare District has been providing input on reopening schools. We have been working closely with the school board members, the superintendent, and key leaders to develop protocols around returning to classrooms. In preparing for the school year, we realized that this year will be unlike any other previous year due to the COVID-19 pandemic. As a result, we will need to adapt and change the way our school nurse program provides care for students in schools. For instance, the traditional use of the health room this school year will be modified in order to focus on students with suspected COVID-19 symptoms. Strict protocols for infection control and social distancing will be followed, and access to the school's health room will be restricted. All students with respiratory, gastrointestinal, or just general symptoms of feeling sick will be evaluated by the school nurse in the school clinic space. The school nurse will perform a screening and decide if student needs testing. The nurse will also perform testing once test kits are available. We don't have tests on hand at present time, but we are working on having a test at each school clinic in the near future. Sometimes this assessment is not easy, so the nurse will be able to consult the Healthcare District's Incident Command team in real time, where physicians like myself will be available for guidance, much like telemedicine service. The school nurse will also help to schedule COVID testing at one of the testing sites available in the community. This can be time-consuming, but the school nurse will try to have it scheduled before students leave the clinic. In order to prioritize school nurse duties to respond to the COVID-19 crisis in our school settings, other duties related to non-acute or non-emergency medical conditions will need adjustment. If possible, teachers should call the school nurse or school district designee before the student leaves the classroom. Our goal is to decrease the movement of students throughout the school as much as possible when a health concern can be managed in the classroom. Depending on the type of symptoms and severity, a student may be referred to different locations to address his or her particular health concern. For example, those students who have other medical needs such as acute injuries, mild illnesses, medication administration management, or other procedures will be evaluated in the satellite area. This area might be just a hallway or office outside the health room and equipped with a cot and privacy screen for confidentiality. This area will be staffed by a school district designee if possible and will be in close proximity to the health room. It is anticipated that a school nurse will be occupied with COVID-19 assessments in the health room for the majority of his or her time. The school nurse will not be able to monitor and care for students in both locations, but will be available for consultation with school district designee when possible. Since medications will continue to be stored in the health room, it will require the coordination between the school nurse, the school district designee for continuity of care for the students. Strong teamwork and communication are necessary for successful outcomes. Students with suspected COVID-19 symptoms will wait in the isolation room until parent pickup after they have been screened and assessed in the health room or satellite area. The isolation area will be monitored by school district designees in separate location from the health room. If the school clinic is large enough and if it is not occupied by students waiting for COVID screening, students can wait there for parent pickup. It is very hard to anticipate the volume of COVID screens that nurse will have to do on a daily basis, and if 6 feet cannot be secured in that area, then an overflow isolation room will have to be used. It is also recommended that all staff monitoring the isolation room should wear personal protective equipment or PPE. Students who are not already wearing a surgical mask will be provided one upon entrance to the room. The parent or guardian of the ill student will notify the school upon arrival and remain in their vehicle. A school district staff member will escort a student to the vehicle. As you can see, this year will require very close coordination and communication between school staff and our school nurses. These protocols have been designed to mitigate the risk of COVID-19 in the school health setting, protecting students, teachers, school staff, and nurses. Throughout the school year, we will continue with close collaboration among the Healthcare District, the Florida Department of Health, and the School District of Palm Beach County.
Hello, my name is Dr. Alina Alonso. I'm the Director of the Department of Health in Palm Beach County. Brenda Galley, my Director of School Health, and I have been involved with your school for many, many years. It is our duty now to become very involved in stopping the spread of COVID in the schools. In order to do that, we will be working closely with the school nurse who will be giving us information for any case or any child that comes to her who may be a suspect of having COVID. The child will be able to go get tested at many of our clinics or through their own private doctor and decide whether they're positive or negative. If they are positive, they then become a person that our epidemiology department will do contact tracing. Now, what does that mean? That means that we will be quickly and very methodically asking questions to determine where the child was, where was he sitting, was he wearing a mask, what classes did he go to, where did he eat at lunch, did he ride a bus? Many questions to determine the extent of the other contacts that he may have come in contact with. So this will not only make sure that we catch all the possible contacts, but it will also help us to eliminate the need for closing down entire classrooms, and certainly we do not want to close entire schools. In addition to clearing a person or one of the students, we will also be able to determine how many days that child has to stay home in quarantine, what other members of the family need to stay in quarantine, and how quickly they can return back to school. This will keep the number of kids out of school to a minimum. So this is a win-win for us in terms of stopping the spread, and a win-win for the school district to be able to keep your business running and people feeling safe and confident that we're doing things precisely and with the science and help that they need to get it done. Thank you very much, and we'll be seeing each other soon.
Hi, I'm Belma Andrick. I'm Chief Medical Officer of Healthcare District, Palm Beach County. As you could already hear from Dr. Chaibar and Dr. Alonso, our agencies came together and worked with the school district leadership in order to help you better prepare for this very unusual school year. We tried to define a little bit better what the school nurse role with the COVID is. You could also hear from Dr. Chaibar that those school nurses' primary job this school year will be to identify who are the children with suspect COVID cases. Nurse will coordinate care of those children in the sense that she will perform screening, determine if that needs to be tested, and then coordinate testing. Nurse will also follow up on the results of this testing. Once the result is obtained, and if the result is positive, nurse will communicate to health department this result. From that point, health department will do contact investigation, like we could hear from Dr. Alonso. Those contact tracers will identify all close contacts to that child and also recommend isolation or further testing. Health department will also communicate to you what is the earliest date that all those children can return to school. That completes the cycle of following up on COVID case. Dr. Chaibar also talked to you about need to having satellite area that will be preferably in a close proximity to the health room, because will require teamwork and strong cooperation between school designee and the nurse. We also talked about isolation area, and I know that many of you, as we speak, are identifying those areas in your school. Our organization will provide PPEs for your employees that will be working in satellite area and isolation room. I heard that many of you have fears how to staff isolation room. That fear is very normal, and many of us that are working in a COVID pandemic from early March have the same fears. But as a healthcare professional who use PPEs on a daily basis, I can tell you that I feel more safe when I'm wearing PPEs at work than I feel in my regular life. I'm also a parent who is sending a child next week to the school. Thank you for taking my teenager back. But I wouldn't send her if I don't feel that she's gonna be safe as long as she wears face masks, maintains social distance, do the good hand hygiene, and listens all instructions that you provide her. For that reason, I feel that whoever works in isolation room, as long as they wear personal protective equipment, they will be fine. So thank you. I hope that working together, we will do the best that we can under those circumstances. And I hope that our chain of communication will stay strong and we will deal with situation as soon as we encounter them. We are here to support you, and we are here to work as one team.